Okay, good afternoon. Clinical cases. Case number 1. Francisco Antonio. He's at 23 years old, young man studying at the university. Since he was 20 years old, he has suffered from severe gastritis. The persistent symptoms are nausea, diarrhea and vomit, heartburn and abdominal pain. History of occurrences dice. How long have you been with the disease? 3 years. What do you usually eat? Fast food. Do you see a doctor regularly? No. Surgical history. Have you had any surgery? No. Allergies. Are you allergic to any medication or food? Yes. To penicillin. Drug history. Do you take any medication for any heart problem? Yes, for gastritis. What medicine do you take? Esomeprazole. Family history. What have been the health problems that your parents have suffered? His mother has sugar. Social history. Who do you live with? His mom, his dad, and his 2 sisters. Where you do study? Catholic University. What do you study? Communication science. Recommendation. Recommendation 1. Follow an healthy diet. Recommendation 2. Take traveling exact supplements. Recommendation 3. Take probiotics. Recommendation 4. Drink lots of water. Recommendation 5. Avoid smoking or using pain relievers. Recommendation 6. Reduce stress. Recommendation 7. Avoid fast food. Case 2. Maria Fernanda. He's a 24 years old with who studied at the Catholic School Center. She has suffered from cancer since she was 12 years old. That tries to live a normal life, but she constantly feels fatigue and weakness in her body. Allergies. Wants to. Drug history. Morphine. Family history. Your father suffered from asthma. Social history. He lived with his parents and sister in a house in Colonial Linda Vista. His father is a marriage, which keeps him very pulsy. Vital things. Temperature 39. Blood pressure 117. Recommendation. Avoid the consumption of sugar with flour and fried foods, and unhealthy tamarind and radiotherapy. And the doctor regularly. Stop red. Thank you.
Case 3. Mirna is a 15-year-old girl. Study at the school. She has suffered from epilepsy since she was 5 years old. The persistent symptoms are nausea, tingling, and some part of the body vision of light and colors. History of obscure disease. How long have you been with the disease? 10 years. What do you usually eat? Health food? Do you see a doctor regularly? Yes. Surgery history. Have you had any surgery? No. Allergies? Are you allergic to any medicine or food? Yes. What not? Drug history? Do you take any medication for any health problem? Yes, from epilepsy. What medicine do you take? Lamotrigine and valproate. Family history. What have been the health problem that your parents have suffered? His parents are healthy. Social history. Who do you live with? His mom and his grandmother. Where do you study? Guatemala. high school. What do you study? Ninth grade. Recommendation: avoid rigor. Do you abandon the treatment? Attend blood test. Case 4. Jose is a 10 years old boy who studied at the Catholic college. He has suffered from cystic fibrosis since he was 8 years old. He constantly feels fatigue, nasal congestion, stomach pain, persistent cold, allergies, acetaminophen, drug history, lumacantform, family history. His father suffered from rhinosinusitis. Social history. He lives with his father and sister in a house in Colonia Jardines. His father is a lover, which he breathes. Viral signs. Temperature 40. Blood pressure 95 from 70. Recommendations: avoid having contact with other patients. Follow your treatment regularly. Attend the doctor.